Should we start?
Hello and welcome to Medical Mondays with Dr. O. Tonight, we are touching on one of the important organs in your system, the kidneys, with a specialist in that field. Remember that Medical Mondays is not establishing doctor-patient relationship with you, but rather giving relevant medical information for a strong health and a strong future. Remember to catch up with the previous versions of Medical Mondays with Dr. O on the YouTube channel, Medical Mondays with Dr. O. Dr. Toyin Opesami is a HIV specialist, a family practitioner, and she has passion for Medical Mondays. Dr. O, you're welcome.
Thank you very much. We have a treat tonight. As speaker, Professor Dr. Suresh B. Patanker or Patanker is all the way from India. He zoomed in this morning, or this morning over there, evening here, from India, 9 hours difference. He's a practicing urologist with more than 35 years experience, works as a consultant and professor, is the head of department at the BJ Government Medical College in Pune, India, which is a management council member, of State Health Sciences University. He has received many honors and awards from the Medical Council of India, Urological Society of India, and other state bodies. He has also published numerous scientific papers in international peer-reviewed index journals, having strong citation index. He is a medical doctor, an allopath, as people will call people like me. He's also qualified in modern medicine, in naturopathic medicine, graduated to super specialist in the Indian system of medicine. He completed master's course in yoga. And guess what? It seems like he's just a man who loves education and studying, because he's currently working on getting his PhD in yoga. So we are truly blessed to have such a wealth of knowledge and experience tonight on Medical Mondays. I must tell you that you're in for a treat, because this amazing doctor, has research that has led to a discovery that we are blessed as a Medical Mondays team to be privileged to for the first time ever. This is the first time he will come out in public to share this, and is coming to share it with us. Isn't that awesome? So I'm going to, hand over the baton to Dr. Patanker, Dr. Patanker, as is favoritely called. So over to you. I'm asking you to unmute. You're still muted. You're muted. There you go.
Okay, can you hear me now?
Yes, we can.
Okay.
And welcome to Medical Mondays with Dr. O.
Yeah, thank you. I'll just start my talk. Before that, I would like to really say thanks a lot for all those kind words to all my friends over there. I'll just start my talk.
We can't hear you. I don't know if you started already, but we cannot hear you. We can't hear you. Dr. Patanker, we can't hear you.
Yes, madam.
We
Yeah,
cannot.
you can hear me?
Now we can hear you.
Okay.
Ay, somebody is talking. I'm trying to mute. Dr. Patanker, are you talking? We can't hear you again. Dr. Patanker, we cannot hear you.
You cannot hear me?
Now we hear you again. I don't know what is going on. We just heard you again now.
Okay. You want me to talk now?
Yes, please.
So again, I will start from the beginning. So I really welcome to all my friends over there. And as I mentioned here, we are fortunate to have Dr. O, the CEO. Dr. O, the medical director at Global Foundation, Maryland. The more important, her wealth of knowledge uniquely positions her to treat the people of all ages and restore the marginalized, disease-ridden, as well as the undeserved population.
Dr. Patanker, we don't see you anymore, and we don't see the slides.
You can't see me?
No, we have an A on the screen. Yeah. I'm sorry, bear with us, everybody. Technical difficulties. We'll get it together in a few minutes.
Can you see me now?
Yes, we can
Okay.
see you now, and we can hear
We
you
go for the next slide.
excellently.
So here I present the beautiful king from Baltimore.
Okay.
Great. Now comes to the today's discussion. The current treatment of kidney stone are conservative or medical line of treatment. It generally comprises of potassium, magnesium citrate, thiazides, and phosphate, etc. Obviously, many times you require a surgical intervention. Excellent approaches are available when the stone is causing any damage to the kidney. Next. But what is lacking? Because there are quite a number of treatment options, but they are marred by the limitations, side effects, disadvantages that follow prolonged therapy. Just to note you, the most commonly used drug for kidney stone in the world, the potassium magnesium citrate, incidence of gastritis, and very poor patient compliance. A very safe, viable, effective, affordable, and alternate therapy is required as on today. Next. This is a small video of, believe it or not, a story of kidney stones.
Dr. Patanker, we are not seeing
Yes,
the
madam.
slides. We are not seeing the video.
You can't see the video?
No, we're not seeing the video.
One moment.
Yes, sir. Yes.
Can you see it?
Now we see, yes. We see the screen.
But you can't see the video.
No, now go to the video. Just go to the video and then we should be able to see it.
Is it being seen now?
Yes.
Great. Hello friends. I'm Dr. Suresh, neurologist, practicing for the last 40 years in city of hospital. As we know, kidney is a very important organ. I've seen various diseases of the kidney. And as we know, kidney is an important organ which protects the other organs like heart, brain, liver, and many others. Now, as we know, kidney stone is a very common disorder in the society. As the time is changing, the incidence of kidney stone is prominent, not only in India, but all over the world. One of the causes is the change in the lifestyle. Why I'm talking this today? Can you go over to some story about the kidney stone which you may not have seen or call this as Filipino. As I mentioned just now, a very common reason of kidney stone can be unnecessary disasters. If neglected, patient can die to total kidney stone. Apart from this, it is also a very painful disorder. It is said it is as good as labor pains one can have to give a child. So let us see some information how this stone is formed. Then I will come back to this my layer of stones. But a lot of misconception about kidney stone. Many people think this kidney stone is formed from a seed of a tomato or a cucumber or maybe from the grains like rice.
Dr. Patanker, the audio is not clear at all. So if you please tell us in a nutshell what it is, it may be more helpful.
Audio is not audible.
We can't hear what he's saying. We're seeing the pictures, but the audio is not
Okay.
clear.
Okay. Audio hacker. So these are
Yeah.
अरे ऑडिओ ऐकायला येत नाही त्यांना इथे परत तू तेच काय चालू करतोय आता मी काय करू चल माझे हे कर हे चालू कर
Bear with us, please.
Hello parents. Hello parents. Hello parents.
That is not working either.
Mute one to share the audio.
Dr. Patanker, it's not working.
Go on.
So, Dr. Patanker, you can share the slides and just present, because I mean, you can do this even better than the video.
Yeah.
Gladys.
Hi, Dr. Bill.
How you doing, doctor? How have you been?
No.
Can you hear me?
No, we don't hear. The audio is
okay,
not.
Fine. Okay, great. I'll just give a live audio then. So I'm talking about
You can take the video off and share your slides so we can see.
okay. You want me to take off the video?
Yes, please, sir.
Okay. So now I'll come back to our own work, what we have done so far.
And we don't see your picture anymore too now. We see the A again. If you allow your video.
Can you see this now?
Now we see you now, yes.
Great. So over a long period, numerous natural remedies are evaluated, examined, and tried also. But sadly, there is no scientific documentation or validation of these formulations. That's a fact of the life. Being a specialist, we conducted a thorough scientific research on our formulation. We did preclinical and animal studies for safety and efficacy of the product. Not only that, we did clinical studies on human subjects, post-animal studies, and the validation of the scientific parameters was done. We had done what is known as prospective randomized placebo-controlled trials and various indications. Next. We have reported these trials and published in globally accepted index journals. And more importantly, this research work has been acknowledged by a presentation of an annual American Urological Association meeting in year 2014. Not only that, this work has been awarded the prestigious Dr. P.V. Rao Oration Gold Medal and citation by the Urology Society of India. Next. I will talk about shortly the efficacy of our research product. The formulation is immensely effective on small, earlier symptomatic stones, where it facilitates the early dissolution and passage for which there is no current treatment in modern medicine. It also shows a significant benefit in patients who undergo surgery like PCNL or URS, where the stones residual fragments remain, and it works as an adjunct for aiding for the clearance of the residual fragments. Lithotripsy is one of the painless treatment. Our medicine will have a better and faster and painless clearance of the fragments. And the most importantly, the formulation has immense use to prevent and reduce recurrence, which is the commonest problem. And more importantly, to reduce the inflammatory or injury caused by the stone crystals and help to improve the function. So these are the publications of our work in various index journals. Next. So in my own clinical practice, I used it for more than 10,000 patients for a duration of ranging from 1 month to 14 months of various types of kidney stone patients, small stones, asymptomatic stones, non-obstructive stones, residual fragments following any urological procedure, recurrent stone formers, post-stent patients, inflammatory condition of urinary tract as a supplementary medicine with the conventional treatment. I must say that no side effects have been noted and the patient compliance is excellent. To sum up, it's a short journey of the development of a scientifically proven natural remedy medicine, and I expect your wholehearted and generous support for the benefit of the patients with this chronic debilitating problem of kidney stones. I am happy to declare that it is available as a calculix with the help of Manna. I am really grateful to them, and obviously all my colleagues over there, to go through this product, and it can be, I'm sure it will be a big help to all the kidney stone patients. Obviously there are many products are coming through Manna. Again, thank you very much. In Sanskrit we call it as Om Sanavavatu. It means God may we all protected. So thank you very much for all my, you are given the patient listening for this. Yes, I done. Thank you.
Thank you so much, Dr. Patanker. I guess I want to just maybe surmise what you said, and so we can be clearer. We know about kidney problems, kidney stones.
Yeah.
I tell my male patients who have kidney stones that they then, when they have it, should have a new appreciation for women who get pregnant and give birth. Because the pain of kidney stone is like the pain of childbirth. So as a man, if you've ever had kidney stones, that's how it feels. when a woman is in labor, that is it. So it is no joke. And that is why this session, that is why this forum tonight is so important. I actually know some people on the forum tonight who have the problem of kidney stones. And what do we do in medicine? We do lithotripsy, meaning we have procedures that break the stones, right? But it's a surgical procedure that break the stone sometimes, and then hope the patient then passes the stone in urine, because kidneys sift, they sift the urine, the urethers, the tubes that attach to the kidneys, urine come through there, and that's how we pass urine. The urine passes through there. So the stones are passed after they've broken. But what your research has led to is a substance that would actually break the stones and has no side effects without surgical intervention, and the stones will be urinated out. That's what you said, right? And this has been presented in the US. It's won awards in India, gold medal awards, correct? It's been FDA approved here. So did I surmise it well, sir?
Okay, can I add one thing over here?
Yes, please.
Madam, we are all specialists, and for every therapy, there are limitations. Many times what happens in the market, medicines are being sold without patient having a proper guidance. There are two types of categories of the patients: small stones, early stones, stones in the tube of the stones. These are the classical patients who can consume this medicine. Patient can also take with the standard treatment. Patient can also take this to prevent the recurrence. One thing is sure, if the stone is become big enough, say more than 8 or 9 millimeters, if it is getting obstructed, in that case, certainly some kind of intervention is required. But in stone population, majority of the patients, if you see, every day I see 5 or 6 patients having 4 mm, 5 mm stones which are in the kidney. They are the classical patients. Or a patient wants a medicine which will prevent the recurrence because he's tired of getting the lithotripsies and all those procedures. These are the very good patients for these medicines. This is my submission. Thank you. I done.
You're saying that patients who are having recurrent kidney stones, they're having them over and over, and they're having stones bigger than 5 millimeters. These are patients that this prevents them from even getting the stones anymore.
Yeah.
Wow. Wow. So what if they have the stone right now? Does it help?
I didn't get you, ma'am.
What if they have the stones, they have stones right now and they have pain? Does your research, the medication that your research led to?
Now, yes. I tell you, there are two types of patients you will see. The stones which are in the kidney, not causing any pain. Patient can start taking the medicine.
Okay.
Then there are patients having stones about 5 to 6 millimeter in the kidney tube, where it is causing pain. There you have to start taking these medicines, and general period we call it of resolution of 3 to 6 weeks. Of course, once you take the treatment, you must check it whether stone has been passed or not. So these are the two types of patients of kidney stones who can consume this medicine.
Okay. Great. Thank you. There's a question from Sister Tower. I'm going to ask you to unmute and ask your question. Great. You're muted.
Good morning, Dr. Patanker. Can you tell us the common cause of kidney stone so we can actually avoid having kidney stone instead of trying to cure it?
You are causing me why the incidence of kidney stone is increasing. It is not only in India, it is all over the world. Now, what you call it as a general metabolic disorder, because of the changes in the lifestyle, the type of food what you are consuming are responsible for various metabolic disorders. There is a metabolic syndrome which comprises of diabetes, hypertension, cardiac, fatty liver, kidney stones, and many others. So this is one of the disorder of our lifestyle which we are adopting, going more towards against the nature.
Thank you.
So there's nothing we can eat or stop eating to stop kidney stones, because there are different types of kidney stones, and there are.
Yes. What can be eaten? See, first thing is plenty of liquids, the natural aqua, water, sufficient amount, exercise, a diet good in fibers, reduce the excess amount of animal proteins, because uric acid is one of the common cause of stones if you take lot of animal proteins. I think if you follow a very good healthy lifestyle, try to cut down excess in anything. I am sure this is a very good natural remedy to reduce the stone formation. Thank you. I done.
Thank you. So there's a question that was sent to me that says, it's asking for the ingredients of the product. And so I'm going to ask Dr. Jha if you can post how, people interested can get the products in the chat box. That'd be great, your contact information. But the second question to that is it broken or dissolved, the stone? For somebody who has that 5 millimeter or whatever stone, is this medication going to break it or dissolve it? Is that your question, Dr. Bill?
Yeah.
Just 1 minute. I want to clarify it.
Okay.
Dr. Bill.
Can I?
Yeah. Please,
see,
go ahead.
The commonest types of stones are calcium oxalate. In calcium oxalate, there are two types of stones, a monohydrate and dihydrate. And sometimes you get phosphate into it. So depending upon the bonding, there is a hardness of the stone. What is known as HU value on CT scan. Hounsfield value, Hounsfield unit they call it as. The stone is soft. That means less than HU value, it will get broken into small pieces. The stone is very hard. A dihydrate stone, say HU value more than 1000. In that case, the stone will not be broken into pieces, but the medicine will allow to passage of the stones.
The question that I have, may I, Dr. O?
Yes.
Yes, please.
I have found that the frequency of stone formation is much, much lower in people who are vegetarians at this point. And the other question is, does your product dissolve the stone or does it break it up? What does it do at this point?
Okay. Can I?
Yes, Dr. Patanker.
Yeah, obviously, what is the change in lifestyle is two things that has happened very recently. Earlier, the diet was mainly in the vegetarian type, vegan type. Slowly, we have switched over the animal proteins. That is one thing. And secondly, we have started using lot of processed food. The processed food removes the natural ingredients which protects the body, and that is one of the reason the stone incidence is increasing. The second question you asked me whether the stone breaks, dissolves, or what. As I mentioned, it is depending upon the consistency or the hardness of the stone. What is, as I said, monohydrate or dihydrate bond between the calcium and oxalate. About, I would say, 55% of the stones are monohydrate and soft, so the medicine acts faster, break into small pieces and passed out. Rest are very hard stones, maybe as I mentioned, as more than 1000 HU value that measures the hardness. These stones, if they are small enough, 5 mm, 6 mm in size, they will be helped to expel, to pass out these stones. Am I clear, sir?
You are muted, Dr. Bill. You are muted, sir. Dr. Bill? Unmute.
Okay, unmuted now. Can you hear me?
Yes.
Okay. Dr. Patanker, can you at least give us an idea of what the ingredients are in this product that you formulated?
The link to that has been posted in the chat box, Dr. Bill.
Okay.
Yeah, I was asking that they put the link on there because remember, Medical Mondays is not about discussing these ingredients of FDA approved medication and all of that. I wanted us to have access to this amazing new intervention that doesn't have any side effects for those who are suffering with kidney stones. And I understand that actually the research that led to this was was quite well populated. There were 5,000 participants, correct, Dr. Patanker?
Can I?
10,000. Yes, please, go ahead.
No. I just want one more thing. It's probably missed out. This particular medicine has got Indian patent, US patent, and Europe patent. That one thing I want to like.
So
patenting is.
Sorry, go ahead.
Patenting is one thing. You have to give a lot of information because patent attorney generally are reluctant to give the patent for any IPR. But fortunately enough, we could get it in US, your country, then Europe, and obviously in India.
So I just
Thank you. I done.
It was posted in the chat box that it is a combination of 6 herbs, and it's 10,000 participants that were included in the research process. That's a very, very good, very well populated study.
It's a good study, yes.
So Dr. Babita Sandhu is asking, Dr. Sandhu, she just posted, how many people benefited from the product during this study?
Okay. As I mentioned earlier, these are the 10,000 patients of my own, in my own clinical practice. We have got all their addresses, contact details, and I can say very surely none of them. In fact, many of these patients, they have taken these medicines and given their own relatives who are having found to be small stones.
Dr. Sandhu, is your question answered?
Yeah.
Thank you. Do you have any other question?
No, not as of now, because I think the whole thing comes down to, again, the eating and the lifestyle. So everything makes sense. So yeah, and I just had that question about the study. I joined late, so I did not hear the initial part. That's why I think I had that question.
Thank you. It was it wasn't discussed before you joined, so that was an excellent question.
Okay.
So for anyone interested for further details, if you go to Manna, MANNA Pharmaceuticals in New Jersey, they have their website posted there, the address, phone number. So take pictures so you can, have that in your record and follow up. This is an amazing tool for people who have kidney stones. Like I said, it is it's painful. It's not something anybody wants to have. So does anyone have any other questions? If you have any questions, raise your hand for Dr. Patanker. Okay.
Is this medicine preventive? I mean, can you use it? Is it something you can use regularly, like
Prophylactic.
Yeah.
Okay. I'll come back to you, sir. The only medicine available in allopathy today to reduce the recurrence is potassium magnesium citrate. It's supposed to correct the low level of citrate, and that is how it is said it reduces the recurrence. But frankly speaking, only 60% of the patients are having low citrate. So 40% of the patients are taking citrate without having any use. Secondly, when you are looking at the recurrence, the therapy has to be a prolonged one. The American study done by one Dr. Park long back, he says the medicines, any stone medicine, if you do not want recurrence, must be taken minimum period of 3 to 5 years. That is a fact. But I'm sure none of the patient will take this for such a long period. So one of the common reason is this potassium magnesium citrate. They call it the portrait or many things. You can also find out your own country. It gives severe amount of gastritis. Patient hardly takes, say, for 2 or 3 weeks, then he stops it. We have done studies of our own medicine, what is known as the Litho risk profile. That means what are the risk factors were available in the patient before starting therapy, like low citrate, low magnesium, high uric acid, high oxalate excretion, supersaturation index. And in some patients, we repeated the study after giving the medicine. What we have seen, it corrects the citrate, it corrects the magnesium, it reduces the oxalate, it reduces the concentration index. So this medicine can be taken over a prolonged period of time, but obviously any person is always reluctant to take medicines for this. But if you take this medicine religiously for a period of, say, about 2 years, it will reduce the recurrence rate significantly. Thank you. I done.
Is your question answered? I'm coming back to you, Dr. Beal.
Yeah, he was.
So
yes.
What did you get from that? You can use it for a long period of time. It's prophylactic?
Well, I mean, yeah. So if you stay on it, say 2 years, yeah, that's what I get.
Okay. Thank you. Dr. Sandhu, I'll get back to you, Dr. Beal, in a minute.
My question is, during the study, were there any side effects over the prolonged period of time? Did any of the patients, they complain about any side effect from this?
Well,
like, again, acidity, of course, it is going to have some effect on your stomach. But were there any other side effect other than just having like gastritis or acidity, whatever, like they were suffering from?
Yeah. Can I?
Yes, yes, sir.
A very right question. What we have seen, if you take it on the empty stomach, what is known as something like a bloating. So what we advise the patient, you take it after food. So that will reduce the chance of bloating. But apart from this, we have not seen any other serious side effects.
And what was the timeline for the study? Like for how many years it was done with the participant? Like what was the duration of the study?
We have done 3 clinical trials. First thing, we did the animal studies for the safety of the product, dosages, and efficacy. We created stones in the rats and given them medicine and followed them up and then the study. So once this phase 1 trial was over, we did it in 2 types of patients. Patients having a stone size less than 9 millimeters, patient having stain, patients who have undergone lithotripsy. Where we have seen the general passage of the stones is within 3 months compared to the placebo. Reduction in the stain complaints, 70% of the patients having better clearance of stone fragments following lithotripsy. So these are what is known as placebo control prospective randomized trials, and they are very well published in index journals. As I mentioned some time back, this same presentation, I had done it in annual meeting of American Urological Association in the year 2014 in Orlando, where this particular research was presented. And one of the remarks, yes, is herbal medicines, if done scientifically, can have a role in management of kidney stones. Thank you. I am done.
Yeah. No, I totally agree that herbal medication, they do have a role in our lifestyle, but a lot of people hesitate because they are not, they don't know the side effects. That's what they worry about. It is something unknown, and that's what worries them to go forward and taking those medications, because the side effects are not known yet. Some people are allergic, so that's why I was asking the question, that does it have any allergies other than just gastritis, or did anyone suffer from any kind of allergies during the period?
So is that a question, Dr.?
No, I was, I got myself.
Okay. So Dr. Sandhu is a lifestyle medicine boarded physician, and we are really blessed by her, because she has taught us a lot on how to eat better, how to change our lifestyles, and a lot of us are benefiting from that already. So thank you, Dr. Sandhu, for your questions. Dr. Bill, now your question, sir. If you please unmute, and Sister Tawa, I'll come back to you.
Okay, I got it. Long-term use of any product that is citrate at this point in time, is that recommended, especially in patients who might have some liver involvement in terms of that? Do you have in your study research, have you found particular patients with, I'll say, particular diseases which this does not help at all and or represents a problem? And I would just think, just in terms of pharmacologically, the citrate over an extended period of time can very well be problematic.
Okay. Can I start?
Yes,
See,
please.
the research on the stone, how long a patient must take medicine. As I mentioned, this was done by Dr. Coe and Park, a very famous urologist from United States. And that is their observation, that if you wanted to reduce the recurrence rate, it should be taken for a period of 3 to 5 years. That is how the whole thing started off, recurrence of stones. Obviously, as I mentioned, it is very difficult for a person to take these medicines for a long time. Your question that if you take a medicine for a long time, like potassium magnesium citrate or any other thing, if you got associated other metabolic problems, obviously the dosage has to be modified. Because, hello?
We can hear you. You're good. You echoing because you kept that other one on. If you remove that other device,
hello,
you will not echo anymore. But we can hear you. You're just echoing.
I can't hear. I can.
We all have sons who help us.
And daughters.
And daughters.
Don't leave the daughters out. My daughters are so precious. I'm always calling them, come on. Oh, look, I can't find this, I can't find that. Dr. Patanker, I don't see him. Oh, one device is still there, the one that was muted.
Yeah.
Yeah. That's why it's echoing, because of the two devices.
Yes. Yes.
Okay, Dr. Patanker, you are muted. Great. Yes. So, can we take the next question? Dr. Patanker.
Hello.
Can we take the next question? Should we take the next question? Can you hear me?
Hello.
Yes, we can hear you. Yes, we can hear you. Can you hear me?
I'm not audible. You're not audible to me.
Really? I can hear you very well.
Okay.
I hear you very well. Can you hear me? Can you hear me? I'm still not audible to you.
Try to take off the earpiece in my ear clearly, please.
Dr. Patanker, can you take off the earpiece? But now we're not audible to him.
Hello.
Take off the earpiece. Take off the earpiece.
Hello.
Hello, can you hear me now?
Hello.
Can you hear me? We can hear you.
Very slowly, ma'am.
Sorry?
Am I audible?
Yes, you are audible.
Okay.
But am I audible?
Very faintly.
Oh, wow.
Very faintly.
Can you increase your volume on your end? Now you are not echoing anymore.
Yeah.
Increase your volume on your end.
No, there is some problem in the line. I can't really increase the volume also.
You increase the volume. Okay, let Sister Tawa
Yeah, but I can't
ask her question. Maybe you can hear her better. Sister Tawa, go ahead. Unmute, ma'am. Yeah.
I just want to know whether there's a difference between the male and female candidates that were used in this this thing that they did? And also, does it affect the age, whether they are young or the old or whatever they use? Does it affect anybody, like female or male, young or old?
Okay. Can I answer?
Yes, please.
Yeah. See, there are surprisingly, if you go back to the history of stones, the incidence of stones in the female was less. That is supposed to be because the female has got estrogen hormone which protects them from many diseases. But over a period of time, since we have changed the lifestyle, the incidence of stones even in the females has increased. At places, it is not 1 to 3, it is almost 1 to 1.5. So now even the females, they are not immune to not to have stones. The same type of mechanism takes place in formation of stones even in the females. So same medicine also can be given in the females. Second question is whether this can be given over here. We had given this medicine up to the age of 7 years. Obviously, the dose will be half of the adults. And even in children, as I said, because children, they do get stones. What is the remedy for that? Either you remove it or wait it or let it pass out. So again, this has got a use in pediatric practice. Maybe Manna can come out with a syrup to make it more palatable in case of children. Thank you, I done.
Thank you so much, sir. Do we have any other questions? Somebody said yeah. Any other questions? Okay, so this brings us to the Medical Mondays moment. And, oh, I'm sorry, there's a question in the chat box. Dr. Patanker.
Yeah.
There's a question that says, who is at the highest risk of developing kidney stone?
Highest risk. Okay, good question. The person who doesn't follow the good lifestyles.
What are the good lifestyles?
I think Dr. Sandhu, she is the specialist in changing lifestyle disorders. The most difficult medicine one can have it. I don't know how she does it.
Well, we have Dr. Sandhu on, we have Dr. Ashby and Dr. Gillam. We have many doctors on here that, are experts at lifestyle changes. So we've been talking about diet, good diet, leaning towards plant-based diet. So hopefully that would help. But there are certain foods that some people with kidney stones that trigger kidney stone in them. There are different kinds of kidney stones. I guess, I
just put one small this thing. See, there is what is known as a genetic disorder also. If there is a family history of stones, there are good chances of one having stones. In addition to that, if you take less liquids, stress, certain professions, once you have got a tendency and you got changes in your diet and lifestyle, then you are the highest risk. As simple as.
He's got two things on.
Yeah, I think Dr. Patanker answered that question. Is kidney disease genetic? You just talked about genetics, right?
Yes. Can I?
Thank you.
Basically, there are genetic disorders like it is polycystic kidney disease, oxalosis, these are generated like you can say Metabolic sponges. So there are certain diseases which for the make the family. Kidney stone, the present knowledge is there is some genes which produce super concentration in some individuals, and they are more prone to get this stone formation. But this is not confirmed, it is still in the genomics. Adam.
Thank you. Thank you so much. So this brings us to the Medical Mondays moment. And I just want to talk about the presentation last week on obstructive sleep apnea. That's my moment today. I'm still living that presentation because it actually, blessed so many people on this forum. I was sharing with someone that I didn't go to bed till after midnight that night because, we needed to deal with some things. But that's what Medical Mondays is about. And I just give all glory to God for this platform and for the ability that each of us have to impact each other's lives on this platform. Do you realize that it's not the speakers, or not just the speakers, but every single one of us? We're learning from each other. 2 weeks ago, I think it was amazing how each of us as participants just, blessed each other with knowledge and imparted some new things that we learned to better us, to change our lifestyles for the better. So I'm grateful for this platform. We'll be looking forward to next week. I promised you exercise. Woohoo. I'm ready to roll. I want us to move. And, next week may be the time that we'll do that. So stay tuned and we'll keep you posted. Dr. Patanker, if you please give us a concluding statement, that would be fantastic.
I didn't get you. Can you repeat? Statement, right? Okay, fine. 2 statements I like to give. I welcome Dr. O, Queen of the Medical Mission. A great job you guys are doing. I really appreciate that.
Thank you.
In today's medicine, nobody wants to work, or anybody who doesn't want to work on the lifestyle. They want to give medicines, surgeries, and all that stuff. I'm happy that you are doing a great job. Really appreciate that. Especially this Medical Monday. I really liked it. Maybe I may think over a year to copy your program and start working on this. I really appreciate all your patient listening. There are some glitches. Unfortunately, I couldn't play that video, but I'm going to place it on YouTube. It's very interesting. You will see we are ego stores of 196 grams. That big. It will be interesting to watch that. And certainly we'll stay connected. Thank you very much. Anything you feel, I'll be always there to be with your one-day clinics. Thank you.
Thank you very much. Thank you. We really appreciate you. And we know that you had to get up very early in the morning, 9 hours ahead, to come here. And we also know about these technical difficulties. I mean, when technology works, it's fantastic. But when it decides to glitch, God have mercy. But we pull through it, and we're so thankful and grateful to you for the knowledge you imparted into us. And, for everyone on the platform that's had kidney stones or, have friends, family members that have been suffering from this, they don't have to suffer anymore. This is fantastic that, we have a product that, we has hardly any side effect, very tolerable, and will make life better and easier. So now, Honorable Gustav.
Thank you so much. And we are grateful for you joining us and for your patience going through all that. We are grateful. Thank you so much, Dr. Patanker, Dr. O, and all the doctors who contributed. We'll come your way same time next week with another exciting edition. Remember to watch previous episodes on the YouTube channel. And when you go there, please hit the likes, hit the notification button, and comment. We are always grateful to have you as family. We'll see you again next week. Bye for now.
Bye. Good night.
Good
Thank
night.
you.
Good night.
Good
Thank
night.
you.
Night.
Thank
Thank
you,
you.
Dr. O.
Good night.
Good night.
Bye, my friends.
Bye, Sister Tawa.
Hi, Dr. Sandu. Hi,
Good night.
Tinu.
Good night.
Good night, my sis. Doing
Good night,
wonderful.
Dr.
Tony.
Sandu.
Good night. Good night.